If you have an itchy rash that is sparing of the scrotum, and when you look at them, they are annular plaques, which means they are plaques that are circular, they're raised, and they have a very scaly border. This is consistent with Tinea cruris, aka Jock-Itch. If the stem asks for what specific fungi is causing it, it's Trichophyton rubrum. I remember this because rubrum reminds me of Cruris. It sounds kind of similar. I know it's kind of stupid, but it helps me memorize it. Oftentimes, you can see this in patients who have diabetes or they have some sort of immunosuppressing condition. Maybe they're taking corticosteroids and their symptoms are exacerbated when they're in very warm ambient areas or they have been sweating a lot. How do you confirm this? You have to make sure you get a KOH or potassium hydroxide preparation by scraping the skin, and you treat with topical antifungals, the azoles, clotrimazole. There's another new one called tonaftate. You can even take oral antifungals, fluconazole, if they're very severe or you have a refractory case. But what answer you have to avoid is nystatin. You do not take nystatin. Make sure you also check the rest of the body for other dermatophyte infections, and these could be Tinea pedis or even corporis. But now that we're in the topic of tinea, we can talk about Candida. Candida can cause intertrigo, where you'll see very moist erythematous plaque under overweight patients, in their stomach folds, or even under patients' breasts. And the most important distinguishing feature here, if they don't give you a picture, it would be to look for satellite papules, which means that you'll see similar lesions outside the main area of infection. Uncomplicated intertrigo can be treated with topical protective and drying agents like zinc oxide ointment or petroleum jelly even. Basically, you want to maintain dry skin and you want to reduce the friction between the skin. You can use cotton or you can use a linen cloth. Now, if you have a secondary infection, for example, you have a complete Candida infection, you can use miconazole, clotrimazole, or fluconazole, the azoles pretty much. Now, seborrheic dermatitis can definitely involve the groin, but it also involves the axilla, aka your armpits, and it's also much more common in the head. You see it on ears, scalp, and you see this very picture mnemonic scaling with very greasy appearance and plaques that can even be pinkish or salmonish in hue on pictures.